Hello students, micturition is the process of boiling urine. So as we already know from our previous classes that from the renal artery nearly 1.2 liter of blood in a minute enters the kidney or renal circulation, which is of 25% of cardiac output. From that 1.2 liter, nearly 10%, which is 1.25 ml per minute, amount of blood filtered by the glomerular basement membrane, and nearly 90% of the blood returned back to the renal vein by the venous circulation. Of that 125 ml per minute, which comes to nearly 180 liter per day of glomerular filtrate, which during passing through the different part of renal tubules undergo the process of tubular reabsorption and or secretion, and which causes ultimately formation of urine. So from that amount of blood only there is formation of 500 to 2500 ml of urine per day. So the normal volume of urine passes per day ranges from 500 to 2500 ml. Now this urine, which is formed in the collecting duct, drain in the ureter at the hilum region of the kidney. Now this wall of the ureter of the both ureter contains smooth muscles which are arranged in spiral, longitudinal and circular layer. Now from this ureter, this urine enters to the urinary bladder by peristaltic movement of 1 to 5 per minute. So regular peristaltic contraction of 1 to 5 per minute moves the urine from the renal pelvis to the urinary bladder. So this ureter passes obliquely through the bladder wall, and it enters the bladder wall from the posterior part obliquely, and they are remain kept. They are kept in the close except during the peristaltic waves, so that the urine cannot reflux from the bladder to the ureter. So here we can see this is the urinary bladder, which is a temporary reservoir of the urine from the kidney to the urethra, and here the two ureter were an opening on the posterior wall of the urinary bladder, and which passes obliquely. Urinary bladder, which is consist of three layers: outer serous, middle muscular and inner mucous layer. The muscular layer of the urinary bladder, like the ureter, consists of longitudinal, circular and spiral muscle layer. The mucous membrane of the bladder is of transitional epithelium variety of epithelium, and it is also called urothelium. Now, this mucous membrane, which is transitional cell epithelium, helps to stress the urinary mucus when there is distension of bladder, and it also prevents the transport of electrolytes and water from the inside of the bladder to the bladder wall. Now here we can see an area in the posterior bladder wall, this triangular area. This is called trigone of the bladder. So it is formed of two corner opening of the two urethra, and the another corner there is opening of the urethra. So two opening of the ureter and one opening of the urethra, and this area is called trigone of the bladder. And where the urethra is originating from the bladder, it is called neck of the bladder, and this is the urethra, and this is the urethral sphincter. So you can see this is the smooth muscles which is called detrosal muscle. The urinary bladder stores urine at a low pressure because of this smooth muscle which has a plasticity property which causes more accumulation without increasing the pressure. So urinary bladder stores urine at a low pressure. Now the smooth muscle of the bladder, which is called detrosal, particularly the circular muscle layer. So the detrosal muscle, and it's mainly responsible for the emptying of the urinary bladder. So when this detrosal muscle or smooth muscle contracts, it mainly increases the pressure within the urinary bladder, and that helps in micturition. Now the smooth muscles bundle passes. So this smooth muscle bundle passes on the either side of the urethra, mainly this longitudinal muscle layer which forms the internal urethral sphincter. So smooth bundle passes on either side of the urethra, forms a sphincter which is called internal urethral sphincter. Now another area which is formed mainly by the circular muscle layer, which is just above the internal urethral sphincter at the bladder neck, this is called sphincter vesicae. Now during voiding, these sphincter vesicae are pulled open by contraction of the internal urethral sphincter. And the function of this sphincter vesicae is mainly to prevent the ejaculation of semen by retrograde transmission. And so it is not so prominent in female, where it is more prominent in male, the sphincter vesicae. Next is the external urethral sphincter, which is formed by the skeletal muscle fiber around the urethra. So here external urethral sphincter, which is formed by the skeletal muscle fibers, and internal urethral sphincter and sphincter vesicae, which are formed by smooth muscle fiber. As we know that there are some differences between smooth muscle fiber and skeletal muscle fibers structurally and functionally. Functionally important difference is that smooth muscles are mainly involuntary muscles supplied by the autonomic nervous system, whereas the skeletal muscles are supplied by the somatic nervous system and they are under voluntary control. So external urethral sphincter, which is skeletal muscle, are voluntary muscle supplied by the somatic nerve fiber, whereas internal urethral sphincter and sphincter vesicae around the neck of the bladder are formed by the smooth muscles which are involuntary and supplied by the autonomic nervous system. So they will come again during the micturition reflex. Now, before going to the micturition reflex, we see the innervation of the bladder. So, sensory innervation bladder. See in this picture, this green are the afferent or the sensory nerves of the bladder. So, the sensation of the bladder is the distension arises from the stretch receptor of the detrosal. So, basically the receptors which are present in the muscles on the bladder, which are stress receptors. So they feel the sensation of distension when there is accumulation of urine within the bladder. Now this sensation of fullness or imminent voiding, that is associated with the maximal bladder filling, originate in the periurethral striated muscles. So in both areas, in the bladder wall as well as in the periurethral striated muscle, there are sensory receptor present. So bladder wall is for the stress receptors for initial sensation of fullness, whereas the periurethral receptors are stimulated when there is imminent voiding, heavy increase in the pressure. Now this feeling sensation from the bladder wall as well as from the periurethral area, they passes through the dorsal column of the spinal cord. So from the bladder wall, they passes by the dorsal column of the spinal cord by two different pathways. One is the pelvic splanchnic nerve and another is the hypogastric plexus. Along with the parasympathetic and sympathetic fibers, they passes by the pelvic splanchnic nerve and the hypogastric nerve from the bladder wall. From the periurethral area, sensory efferent from the urethra reach the spinal cord by the pudendal nerve. So sensation pass by this pelvic splanchnic nerve, hypogastric nerve as well as by the somatic pudendal nerve. Now from here, these fibers goes to the spinal cord area of from the S2 to S4. So from the spinal cord of S2 to S4, sensation reach some other area, supraspinal area. These are the pontine and suprapontine micturition centers. Now the pain fiber. So that was the stress fibers. Now pain fiber, which is responsible for the pain sensation from the bladder, goes through the anterolateral column of spinal cord, not by the dorsal column of the spinal cord. Now think the situation which affect the dorsal column of spinal cord. So if any pathology like tabes dorsalis or tuberculosis which affect the syphilis which affect mainly the dorsal column of the spinal cord. So that will abolish the stress sensation of the bladder. So micturition reflex will be hampered. But the pain fiber which passes by the anterolateral column of the spinal cord will be intact. In condition which affect the anterolateral fiber of the S2 to S4 of the spinal cord, what will happen then? The pain sensation from the bladder will be disturbed, but the feeling sensation which is responsible for micturition will be remain intact. So the conclusion is that the pain sensation goes by the dorsal column and the anterolateral column, and the pain bladder feeling sensation goes by the dorsal column. So pain fiber by the anterolateral column and the stress sensation goes by the dorsal column of the spinal cord. Now the motor innervation of the bladder. So the motor supply by the parasympathetic fibers. So parasympathetic fibers which are formed by the S2, S3 and S4 which form pelvic splanchnic nerve, and it supply the bladder and as well as the urethra. Not only parasympathetic, bladder is also supplied by sympathetic nerve which is formed by the L1, L2 and L3. Now, these sympathetic nerves supply again the bladder, detrosal, also bladder neck and urethra. So we already know that the function of parasympathetic and sympathetic are just opposite. So here the parasympathetic supply of the bladder is excitatory, that means it causes contraction of the bladder, whereas the sympathetic supply of the bladder wall or detrosal are inhibitory, which causes relaxation of the bladder or detrosal muscle. Thus opposite happens in case of urethra. Parasympathetic supply causes inhibition and sympathetic supply causes contraction of the urethra, particularly the sphincter vesicae, and contraction of sphincter vesicae prevent retrograde ejaculation or transmission of semen from the seminal vesicles to the bladder. Next is the somatic supply of the bladder. Now the pudendal nerve which is formed by the S2, S3 and S4. So this pudendal nerve which is somatic nerve, it supplies the skeletal muscles which are the external urethral sphincter. So we can see the bladder has three types of nerve innervation: sympathetic, parasympathetic as well as somatic supply. Now the parasympathetic fibers which supply the detrosor, which causes excitation or contraction of the detrosor muscle and the internal urethral sphincter, but it causes inhibition to the sphincter vesicae. So parasympathetic stimulation causes contraction of the detrosor muscle and relaxation of the sphincter vesicae, which helps in micturition. Whereas the sympathetic fibers through the hypogastric nerves, they are inhibitory to the detrosor muscle and the internal urethral sphincter, and which causes retention of urine. So parasympathetic causes micturition, sympathetic causes retention of urine. And in addition, sympathetic is excitatory to the sphincter vesicae, which causes contraction of the sphincter vesicae and which helps to prevent retrograde ejaculation of semen. Now the somatic fibers. So somatic fibers through the pudendal nerves is inhibitory to the external urethral sphincter. So what happened during micturition? There is parasympathetic stimulation which causes micturition by contracting the detrosor muscle and internal urethral sphincter and causing inhibition to the external urethral sphincter by the somatic pudendal nerve. So micturition reflex. Micturition reflex is basically a spinal reflex. So whenever we say about a spinal reflex, we know that a reflex must follow a reflex arc. So here, what are the components of this micturition reflex, or what are the components of micturition reflex arc? So first one is the receptor. For micturition, the receptors are the stress receptor which are present in the trigone of the bladder wall. So in the trigone area of the bladder, which is in the posterior wall of the bladder, there are stress receptor present. So when there is accumulation of urine within the bladder, filling of the bladder that causes distension of the bladder, there is stimulation of the stress receptors which initiate the reflex. So receptor is the stress receptor in the trigone of the bladder. Next is the afferent fibers. So here the afferent fibers are the pelvic nerves. So the pelvic nerves are mainly the S2, S3 and S4. The pelvic splanchnic nerves are the afferent limb of this voiding reflex, whereas the parasympathetic fibers and pudendal nerves to the bladder and the urethra constitute the efferents. We already know the parasympathetic fibers S2, S3, S4 supply the detrosor muscle which causes contraction of the detrosor muscle, whereas the pudendal nerve S2, S3, S4 somatic nerve that supply the external urethral sphincter which causes relaxation of the external urethral sphincter. So these are the efferent nerves, parasympathetic fibers and the pudendal nerve. And the center here is the sacral micturition center, which is S2, S3 and S4 of the spinal cord. So these are the 5 components of micturition reflex. Stress receptor in the trigone of the bladder wall. Afferent is the pelvic nerve, S2, S3, S4. Center is the S2, S3, S4. Efferent is the parasympathetic fibers and the pudendal nerves. And effector is the detrosor muscle which causes contraction and external urethral sphincter which causes relaxation or which relaxes during micturition. So that is the micturition reflex. So this is spinal reflex. So this spinal reflex of micturition. So during micturition, the perineal muscle and external urethral sphincter which are supplied by the pudendal nerve are relaxed, whereas the detrosor muscle which is supplied by the parasympathetic fibers contract and the urine passes out through the urethra. So this simple spinal reflex is active in newborn and very young child, say up to 2 to 3 years, 4 years. But beyond that, the micturition is not a simple spinal reflex. In a newborn, what happens? urine accumulate as they feed, and there is accumulation of urine. After sometimes when there is accumulation of certain amount of urine, there is contraction of the detrusor muscle, relaxation of the external urethral sphincter, and micturition occurs automatically, reflexively. But it does not happen in case of adult or us or a say 10-year child. Why? That is because micturition, though it is a spinal reflex, it is heavily influenced by the higher centers from pons, midbrain and cortex. That's why in adult micturition, though it is a spinal reflex, but it is heavily influenced or modified or facilitated and inhibited by other areas of the brain from the pons, midbrain and cortex. And that is why along with age, when our nervous system become myelinated, become more developed, more generated, more integrated, micturition we can voluntarily control our micturition. The threshold for voiding reflex is adjusted by the activity of facilitatory area which are in the pontine region and inhibitory area which are in the midbrain centers. So it is not a simple spinal reflex, it is affected by other area of the brain like the pontine region and the midbrain region which facilitate and inhibited these spinal micturition centers. And not only that, it is subject to voluntary facilitation and inhibition. So if we have a urge of micturition but our circumstance is not allowing to void the micturition, we can hold our micturition for some time. So it is voluntarily controlled. On the other hand, we can micturate even when there is no urge for micturition or voiding. We can voluntarily, forcefully can void some amount of urine even when there is no sensation for micturition. So this micturition is subject to voluntary control. So it is facilitated and inhibited by our voluntary area which is the mainly the cortex of the brain. Now how this voluntary facilitation and inhibition occurs? So this voluntary facilitation occurs or inhibition occurs by the perineal muscles and external sphincter. So external sphincter and perineal muscles which are skeletal muscles, striated muscles supplied by somatic nerve, they can be contracted voluntarily. So by the somatic nerve, they can be contracted voluntarily and preventing urine from passing down until the favorable circumstances to void is not there. So it is facilitated by the somatic nervous system and by the cortex. On the other hand, relaxation of the muscle of the pelvic floor. So voluntarily we can relax the muscle of the pelvic floor, and on relaxation of the pelvic floor and by increasing the intra-abdominal pressure voluntarily causes downward tug on the detrusor muscle which also help to initiate its contraction or micturition. Okay, so micturition is a spinal reflex which is heavily influenced by higher center like pons, midbrain and cortex. Now the micturition centers. So there are several centers for micturition. The primary one is the sacral micturition centers. So sacral micturition center composed of S2, S3 and S4. So it consists of the sacral detrusor nucleus and sacral pudendal nucleus. So sacral detrusor nucleus supply the detrusor muscle by the parasympathetic nerve fiber, whereas sacral pudendal nucleus supply the external urethral sphincter by the pudendal nerve. Next is the pontine micturition center. So it is situated in the pons. It corresponds to the locus coeruleus of the rostral pons. The pontine micturition center coordinates the activity of the bladder and the urinary sphincter. So the function is mainly to coordinating the bladder and the sphincter and relay input from the suprapontine center. So it also take the input from the suprapontine area and relay is to the sacral micturition center. The cerebral cortex. So the detrosor motor area is located. So for the detrosor control of detrosor muscle, detrosor motor area is located in the medial frontal lobe. The limbic area also excite the sacral micturition centers. Other area of micturition like the basal ganglia. So basal ganglia, it inhibit the sacral micturition center. So there are several micturition centers, sacral micturition and supraspinal like pontine micturition center, basal ganglia or midbrain micturition center and cerebral cortex micturition centers. Next is the micturition cycle. So it is the cyclical change of volume and pressure in the bladder, which is called micturition cycle. And we can see micturition cycle has 4 phases. First phase is the filling phase. So bladder filling. So what happened during bladder filling? The detrosor muscle relaxed, urethral sphincter contracted, pelvic floor also contracted, and it causes retention of urine or accumulation of urine. This is the first phase. Now after some accumulation of urine, there are first sensation to void the micturition. So bladder become half full, urinary voluntarily inhibited. Now in this stage we can pass urine or we can hold urine by voluntarily modifying the external urethral sphincter, either contracting it or relaxing it. Now from this there is intense desire to void. Here it is difficult to hold, we need to pass it. So there is, after that there is starting of contraction of the detrosor muscle. So when there is contraction of the detrosor muscle and relaxation of the external urethral sphincter, the urine from the bladder goes out through the urethra, and which is the micturition, which is called micturition. So these are the cycles of micturition. So bladder filling phase and bladder sensation to void, it is 2 phase. First sensation to void and intense sensation to void. Then there is normal desire to void or micturition. When micturition, the pressure in the bladder become very high. So in the filling phase, bladder pressure does not increase that much, but in micturition phase, the pressure increases and urine pass down, and in that case there is contraction of the detrosor, urethral relaxation and pelvic floor relaxation. Whereas in filling phase, opposite happens, detrosor relaxes and contraction of the sphincter, and pressure does not rise so much because of plasticity of this smooth muscle and the mucosa of the urinary bladder. So that is called the micturition cycle. So next class we will discuss about cystometrogram and cystometry and also the abnormal bladder condition. So see you on the next class.